What if you woke up speaking flawless French, zero lessons taken, or your own fingers rebelled, unzipping your jacket mid-conversation? Human oddities like these defy science, turning every day bodies into viral riddles that baffle experts and spark endless online debates. Get ready as we count down the top 6 real medical mysteries that will rewrite what you think you know about yourself. Let us dive in, starting with number 6. Number 6, exploding head syndrome. Picture this. You are drifting off to sleep, everything is quiet, and suddenly your brain unleashes a sound like a gunshot, a slamming door right inside your skull. No earplugs needed because it is not real sound. It is all in your head. Sounds like a horror movie, right? But exploding head syndrome hits about 10% of us at some point, and it has gone viral with people sharing their what the heckin' stories online. Doctors call it a parasomnia, a sleep disorder that occurs during the transitional period between wakefulness and dreaming. Your brain's auditory nerves might misfire, creating these imaginary booms. But why? Stress, fatigue, or even caffeine can trigger it. Yet scientists cannot pinpoint the exact wiring gone wrong. It is harmless, no pain, but startling enough to jolt you wide awake, heart pounding. Treatment? Mostly reassurance and better sleep habits, since meds do not always work. Wild, right? Have you ever exploded in your sleep? Number 5, autobrewery syndrome. Ever heard of getting drunk without touching a drop of booze? Autobrewery syndrome turns your gut into a secret distillery. One minute you are munching pizza, the next you are slurring words and failing a breathalyzer. This one has blown up online with stories of people arrested for DUI after innocent meals. It happens when yeast or fungi overgrow in your intestines, such as Saccharomyces cerevisiae, the same bug that brews beer. Your body converts sugars to alcohol, spiking your blood levels to 0.1% or higher, enough for a buzz or blackout. Famous case? A Japanese woman in the 70s who kept landing in the ER drunk until docs cultured her gut and found the brewery. But here is the head scratcher. Why does this yeast party start in the first place? Antibiotics might disturb your microbiome, or underlying issues like diabetes play a role, but science has not cracked a reliable prevention or cure. Diet tweaks and antifungals help some, but flare-ups are sneaky. It is like your belly is throwing a rave you did not sign up for. Number 4, Stone Man syndrome. Number 4 takes us into body horror territory. If you have seen those tree-like growths in viral videos, this is it. Imagine your muscles, even ligaments, slowly turning into bone, not metaphorically, but literally, locking you in place like a human statue. That is Stone Man syndrome, a genetic issue so rare that it affects just 1 in 2 million people. It starts innocently, a kid with a wonky big toe, then any bump, or surgery sparks flare-ups, where soft tissues stiffen, building a second skeleton over time. The culprit? A mutation in the ACVR1 gene that flips injury response on its head. Instead of healing, your body says, more bone. Famous sufferer Harry Eastlack donated his body to science in the 50s. His skeleton is a twisted showpiece on display, fueling viral awe and chills. Science knows the gene, but why does it trigger such overgrowth? Total mystery. No cure, just avoiding trauma and pain meds. It is a slow-motion prison, yet these folks' resilience, inspiring. Number 3, alien hand syndrome. What if your right hand suddenly had a mind of its own, grabbing your face, undoing buttons, or even slapping you without your brain's okay? Alien hand syndrome is a neurological agony where one limb rebels, acting voluntarily but totally against your will. Viral clips show patients wrestling, their rogue hand like it was possessed. Usually hit after a stroke, a tumor, or a brain surgery splits the hemisphere's control. Your left brain might plan to pour coffee, but the right hijacks the hand to fling it. Doctors first noted it in 1908, but the full "why this hand? Why now?" The puzzle stumps us. No fix beyond therapy or tucking the hand away, but some use the other to control it. One patient quipped, "It is like living with a naughty puppet." Creepy, right? Your body's betrayal at its finest. Number 2. Alice in Wonderland syndrome. Ever stepped into a room and sworn the furniture's shrunk, or your hands ballooned to cartoon size? Alice in Wonderland syndrome hijacks your senses, making the world or you deform like Lewis Carroll's trippy tale. Migraine sufferers know it best. Walls ripple, time slows, body parts morph for minutes or hours. It has gone viral with artists and celebrities like Katy Perry sharing episodes. This is linked to epilepsy, infections, or even stress meddling with the brain's parietal lobe. But why? Do these brutal hallucinations fire off? Unclear. Kids get it most, often outgrowing it by their teens, but adults battle on. No pill zaps it, just treat the trigger, like migraines. Number 1, foreign accent syndrome. And finally, our number 1 spot, the accent swap that has caused countless what-if memes and accent challenges. You are chatting with friends, then a head injury, stroke, or migraine flips your voice to sound. Straight out of another country, British to Swedish, American to Italian. Foreign accent syndrome has TikTok in stitches with reenactments, but for the 60-ish documented cases, it is no joke. Brain damage tweaks speech muscles and rhythm. Pitch rises, consonants slur, mimicking an accent. But it is not learned, it is rewired. A UK woman post-stroke sounded French. Science gets the brain hit, but why a specific accent? Cultural bias or accidental neural remix? No answers and speech. Therapy helps little. It is like your tongue got a passport without you. Hilarious in videos, heartbreaking in life. There you have it, the top 6 viral human oddities keeping scientists up at night. From boozy bellies to rebellious hands, our bodies are walking enigmas. Which one freaked you out the most? Smash that like if you are grateful for your normal quirks, and comment below your weirdest body glitch. Don't forget to subscribe for more deep dives.